Hello, and welcome to Practice Makes Purpose, the podcast where we connect JMU Nursing alumni who are making a difference in healthcare and beyond. I'm your host, Caitlin Boltman. Today's guest is Cameron von Kannewurff, a JMU Nursing alum class of 2020. He's currently working on his doctorate of nurse anesthesia practice at Mary Baldwin University, and he's a volunteer paramedic with the Tuckahoe Volunteer Rescue Squad. From leading EMS crews to managing complex cardiac ICU patients, Cameron's journey is a powerful example of lifelong learning, leadership, and service. Whether you're a nursing student, a fellow alum, or just curious about the many paths a nursing degree can take, this episode is packed with insight and inspiration. So, let's dive in. All right, Cameron, well, thank you so much for joining me. I am so excited to kind of have you as you're my first guest. So
wow, that's an honor.
So this is super exciting, and we'll just kind of jump right in. So first, if you see me looking over, I'm just looking at my questions.
Yeah,
of course. To keep us on track here. So first, let's just talk about what inspired you to pursue nursing and kind of eventually into anesthesiology.
Sure, that's kind of a long story. But basically back in the day, I was training on the football team at Glen Allen, and one of the guys on our team got hurt. And there was an EMT there who was on our team, and it's like, oh, this is kind of cool. He did like his little assessment thing, and then he invited me to enjoy it on a ride along, which was pretty interesting, which led to a couple more ride-alongs. And I think I'm like third shift riding, and we had a really sick pediatric patient. We were giving nebulizers in the back of the ambulance on the way to the hospital, and I remember we handed off to a male nurse in the ER, and I don't know why, but I was just like, I'm going to be that guy. And then from then on, I took my first EMT class, like 16 years old, and that kind of spiraled into going to JMU, getting into the nursing program on the second time around, and getting into school. And then actually, during my externship at Memorial Regional Medical Center, I had a patient that was going to the OR, and the CRNA was like, hey, do you want to like shadow? You're a student. I'm like, sure. I had no idea what I was walking into, and ended up spending the entire night with them. My preceptor didn't know where I was. And it was a really fun experience, and I learned a lot, and that's kind of where the spark of anesthesia started for me.
That's so cool. And then your journey at JMU, kind of what did that look like? I know you said you got into the nursing program the second time around, so maybe if you want to talk about that a little bit.
Yeah. So I mean, JMU's nursing program is ridiculously competitive. I think it's up more than 90 students now, right? It was a little tight back then.
Yeah, I think we take 113.
Oh, it's wonderful.
Yeah.
So I didn't get in the first time around. It was super competitive. Retook a couple classes, my physiology and my statistics class, to be more competitive on the grade side, and ended up getting in. So 4.5 years overall. It was wonderful. I'm actually very thankful that I had the extra time to get in. It allowed me to do a lot of the things like within the rescue squad that I was prioritizing in the early parts of my undergraduate career, and didn't necessarily get that A in, anatomy. So
yeah,
it worked out, and I was still able to reap the benefits of a wonderful program. But I was sweating there for a little bit.
Yeah, I can imagine. And then you're in the DNAP program at Mary Baldwin, right?
Yes, ma'am. So I'll be their third graduating class there.
Okay, cool. So how has that transition been for you?
It's actually been really, I don't want to say easy, because it's doctoral level work, but JMU prepares the students exorbitantly well. Writing the care plans every shift that we went into, we're doing that in school, graduate school, to prepare for our operating room shifts. And the coursework at JMU seemed to really prepare me well, in terms of like collaborative thinking and like leadership stuff. I didn't see from other nurses when I was working in the ICU. So I think overall, everyone says that JMU is a great program, and I didn't have like a very good perspective exactly what that meant while I was in the program, but just looking at the field of nurses and the people that I've worked with, JMU grads have always been some of the best. So
Yeah.
I think we did a good job in preparation.
Awesome. Well, so you've been a paramedic for over a decade. So how has that shaped your approach to patient care in like a hospital setting?
Yeah. So I've actually only been a paramedic for about 2.5 years.
Okay.
Maybe a little bit more than that, but I've been an EMS, I've been an EMT for 10 years.
Okay. Gotcha.
When I graduated from nursing school after a year and a half of being a new grad, I got my CCRN, and then I did a nurse to paramedic bridge program in Missouri, which allowed me to have the paramedic stuff and the extra fancy tools.
Gotcha.
But it's been very influential in me as a provider. I think it definitely gave me a leg up in undergrad nursing, just kind of knowing how to talk to patients and take a history and kind of walk into the room with confidence and kind of be uncomfortable in a stressful situation where nothing's ever going right.
Right.
Because we always give the medics a lot of crap for bringing in a disaster of a patient, but we're really working with nothing, no history, trying to figure things out. And I think that was really huge. And then the time management skills, how to do a lot of things in 10 to 15 minutes and really make a profound impact on the patient for treating life threats and trying to prioritizing your ABCs and the things that are kind of super emergent to that patient's condition. It's been profound. And then obviously now moving into the OR and as a nurse and anesthesiologist, it's been helpful I remember the day when I was the new paramedic. I just gone through, I got released, and everyone's like looking at me, like, what are we going to do? That you were prepared for that. And then now moving into that role where you're in anesthesia and you're at the head of the bed and everyone looks to you, right. I feel like we're very well prepared for that role because I've had that kind of pre-experience and exposure therapy to that, if you will.
Yeah.
Yeah.
That definitely makes sense. And I imagine there's a lot of like overlap with stuff you've learned, the good foundation you've learned, and then stuff you're continuing on in your doctoral program. So maybe talk about some kind of like how you felt prepared for your doctoral program.
Yeah, I mean, so I can't remember who it was that said, but like being a nurse makes you a better paramedic and being a paramedic makes you a better nurse, and I think that's really true. It's just different perspectives and everything. In terms of like preparation, exactly of how the EMS side has prepared me for doctoral work. Like I said, the leadership, the critical thinking skills, synthesizing a care plan on the spot when you're just looking with things and being able to pivot as you find out more and more about the patient's condition and the history. That kind of realm, I think, has been awesome. And then I think that also brings up a level of comfortability, like I said, in the uncomfortable situation. Because, being a grad student going into a completely new environment where you're expected to know and perform just like a physician anesthesiologist, that's a big jump in the progression of development as a nurse.
Yeah.
I was well prepared, but it's just a completely different jump and role. So I think it helped a lot. We'll see. We haven't hit the OR just yet, but it's helped out in simulations.
Yeah, I can imagine. So I'm sure you've worked with a lot of complex technologies and stuff like that. So what was the learning curve for you, and like how did you adapt?
Mm-hmm, sure. When you talk about technologies, what are you trying to
just
specifically?
Anything? Like either simulations or anything that you things that you work with on a day-to-day basis.
Sure. So I was very blessed. I worked in a cardiac intensive care unit at Nova Fairfax immediately upon graduation. And to this day, that's the sickest unit I've ever stepped foot in, even being a traveler for about 2.5 years. And we took care of every single cardiopulmonary device that was there. We did VA, via ECMO. We did balloon pump, Impella, CRT, LVADs, and swans every day. It was a lot to learn, especially as a new graduate nurse. I mean, I had some grasp of like pacing from the pre-hospital days, but jumping into something that was like completely new, of a heart-lung bypass, no idea of what was going on, especially during the middle of COVID.
Right.
So I graduated right in the height of that,
Right.
and started as a new grad in the ICU right in the heart of it. It was wonderful.
Yeah.
But I think everyone in that unit was really good about teaching, and just realize, like, when you're a new grad, like, everyone is an expert, especially compared to you. Like, you have your degree and your license, but you're surrounded by people who have been there for 3 to 10 years and just asking them questions. So one of my friends, it was 2:00 in the morning, and I walked over to his room and said, "Hey, like, tell me everything about this ECMO machine." And he started going through everything. And then the next day I was like, "Oh, tell me about this LVAD." And then he'd tell me everything. So I wasn't actually trained on the device, but I was learning things. And then things would start connecting during rounds, and we'd talk about the different therapies. And then as the progression through, we had a very structured approach. So your first thing was you got CRT, and then you got your TTM or post-arrest protocols. And then you went to balloon pump, and then you went to Impella, and then you went to ECMO. So it kind of like all kind of build up, kind of like we did in nursing with CLAMPS 1 and CLAMPS 2. But then just continuing to ask questions. I mean, we talked about JMU lifelong learning. It's a thing in healthcare. It doesn't go away, unfortunately.
Yes. So do you have any like good strategies for like, because I'm sure you're, especially as a new grad, you're getting information overload. How do you soak up all of that information? Do you have any like strategies for that?
Yeah, I mean, it is a lot, right? And you know so much, but then at the same time, you also know nothing because you have no real like clinical practice. Like, I didn't have the ICU rotation, unfortunately, at JMU. So I didn't get to see this before I got jumped into it. So I just tried to kind of treat my day. We worked 312s as a 4-day work week, and I'd take 1 day a week to look up on things. So Paul Moreno has the ICU book. I believe that's the title. And it's like 700 pages. I read it cover to cover. And it's a very dry read, but it talks about everything. And then when I'd have it at work, and so instead of like scrolling through my phone on TikTok, when I had a down hour, I would read the book or read about the patient that I was taking care of, that kind of like chart diving that would really bring up, okay, this makes sense because of this makes sense because of that. And then just asking questions, I think. People were pretty forthcoming. If you're eager, you have a good personality, and you're willing to learn, they're going to teach you. They just love to give out their knowledge.
Yeah. Yeah, that's awesome. So can you share a moment from your ICU experience that has kind of really stuck with you?
Had several, but I think that the big thing that kind of like encompasses is just like how much of an advocate you can be in your patient's care. I was traveling at a hospital, which will remain nameless, but me and the nurse practitioner had a differing opinion on the way that this Impella should be managed. And the Impella was an Impella RP Flex, which was a new device, so everyone's kind of still kind of on edges about that, but it had clotted off, and we had been able to flush it with TPA and then get the device to restore. And we had flows restored, and everything was kind of continuing on. But the NP was adamant that we needed to continue this TPA infusion. And I was calculating up the doses of the TPA, and it was about like 6 times the stroke dose of a patient going to the ER. And I knew in my heart that this was the wrong call. I brought it up to the nurse practitioner, and they were like, "No, we're not doing that. This is my ship." I escalated to the attending, and they're like, whatever. So I was able to utilize my resources. I went to the Impella rep and had them argue for me. I went to pharmacy rep and had them argue for me. I had my charge nurse help argue for me, and then I brought my unit director in, and finally they started listening. It didn't actually make a difference in the patient's outcome, thankfully, because we stopped it soon enough. But had that continued on for another 12 hours, I think that really could have had a detrimental impact on the patient's condition. And all that was, not to pat myself on the back, was just, I don't understand why this person wants to do this. Tell me why. And just keep asking more questions, and then they eventually come around to the same answer that you had. And then using your resources. But as a nurse, that's our job, to help keep people safe. Because this nurse practitioner had 18 other patients to worry about, was a little overworked. This is the last thing on her totem pole. Otherwise, the patient was fine. And so you have to keep bringing things up, as frustrating as that can be for them.
Yeah, but what a good lesson in patient advocacy. I mean, that's awesome.
Yeah, that's one thing that JMU like really imparted on us.
Yeah, that's awesome. So I know you said you graduated in 2020. So kind of what was starting your career during the pandemic? Kind of what did that look like for you?
It was very interesting. And also, I mean, I wouldn't trade it for the world. I learned so much. The acuity level on our unit just increasingly jumped, and then it kind of stayed that way. But I was a new grad who was experiencing how to prone patients, and we'd have people on triple pressors every single night, which apparently was not a regular occurrence. I didn't know that. So it definitely made things a little bit more difficult because the normal orientation of like we had 20 weeks of orientation, so it was a hardy orientation, but just you got to see what your normal patient population would look like. You start with the stable, and then you move to the stable sick, and then you move to the double vent or the single vent, and then you kind of progress up to the sick admission. Mm-hmm. It was jumping in like midway through in terms of the actual acuity level of patients, which was a huge learning curve. Mm-hmm. But I think that kind of pushed me to kind of progress much quicker than I would have if I didn't do that or have that experience. So I'm very thankful for it. Unfortunately, the pandemic had to happen, but yeah. I capitalized on the opportunity. The only downside was all the travelers were making a whole bunch of money, and I was sitting there with my new grad pay. That was the hard part.
Yeah, I could imagine. So you found that those experiences kind of shaped, you know, your career. Now here we are 5 years later. How has that shaped who you are now, if that makes any sense?
It's definitely kind of shaped my care as a provider. I said I have a lot more of the pre-hospital, like life threats kind of mindset always is like first and foremost. And, you know, the calm, comforting, nurturing nurse side takes a little bit for me to get there, but I can do it. Not all male nurses are inconsolable. But it's definitely, that experience has stuck with me, and I think it's provided a lot of knowledge, foundational knowledge that I'm using now in school, that I wouldn't have had prior. And just experience. I mean, that unit was so sick when I went to other hospitals. I had all this wealth of experiences to pull from, and then say, hey, we did it this way at this hospital. Why do you do it this way? And then let's talk about what the best way to do things for our patient today is. And that kind of helped out with actual continuity of care and such, or quality of care.
Awesome. So I saw like on your resume, your LinkedIn profile, that you've led some training programs. So what do you enjoy about teaching others, and do you have any advice for new nurses or EMTs?
Yeah. I've done a lot of training things. I always seem to get roped into them. When I was actually in the JMU Nursing School, I led a technician academy at Harrisonburg Rescue, which is in Harrisonburg. So if any nursing students are listening, I 10 out of 10 would recommend volunteering there. It was a wonderful experience, but I think we would teach people from the ground up of how to like be just a normal person, and then learn how to cut people out of cars upside down in a river with ropes and such. It was really, really fun experience, and kind of translating that knowledge, I realized, was the like most important thing. So the earlier you can get involved with training, the better. Someone always said, like, we train to teach the next generation, but we also train to keep ourselves sharp. And I think that was very profound, because if you can explain things simply, you truly know it on a deep level. And then when people who don't know anything about the topic ask you a question that's kind of off the walls, you can relay it back into layman's terms. You understand what you're talking about. Mm-hmm. So I think that's kind of a huge factor. Like, once you get into that, you're a new graduate nurse, you get comfortable, you learn your devices if you have those on your unit. The next thing is kind of precepting. Can you take your knowledge, the things that you've learned from school and practice, can you synthesize that and give that back to somebody else in an articulate, clear fashion, and then kind of groom someone into someone who's going to provide safe care throughout their hospital stay. That's hard to do. It takes a
Yeah.
lot of patience and grace, but if you can do it, I think it's very helpful. And then from a knowledge standpoint, like my biggest way to study for grad school right now is I go on a 10-mile run with my running mates who know nothing about medicine, and I teach them all about pharmacology or whatever we're learning. And they ask some really interesting questions that I would not have expected, but it forces me to think about the material in a different way and really grow with it. So
Yeah. That's awesome. So clearly you're very passionate about patient advocacy. So what does that look like kind of in your day-to-day work?
I mean, we'll see how it is going to be seen in terms of like the actual anesthesia stuff. Keeping people safe is obviously priority number one in that regard. Keeping them comfortable is priority number two. But in terms of like my experience as an ICU nurse, it was always just paying attention to the little things. I can't take credit for this story, but one of my colleagues when I was working at VCU had a patient who had a dog, and this patient was emergently brought in. They had some heart issues, and they overheard that this patient's dog was at the house all alone for like 2 weeks. And they were able to get to connect with the social worker to make sure the sheriff came out and had a welfare check on the dog, and the food was arranged for this dog. And when the owner found out about that, who was the patient, they just completely lost it with just joy. It was absolutely incredible to watch. So like paying attention to little things. Someone will say something and it doesn't necessarily mean anything to you, but as you spend that time with the patient over your course of your 12-hour shift, you realize that something is important, and that's something that you can pay attention to, whether it's something clinically or something more psychosocial and holistic than that. It all kind of comes around. So that's how you kind of advocate for your patients in that regard. That's why I love the whole anesthesia side of things, right, is because we're sitting next to the patient for the entire case, and they don't know what's going on. They can't, well, hopefully they don't know what's going on, and remember any of that. And they can't make any choices. So we are advocating for them to make sure that they're safe, their blood pressure stays fine, their heart rate stays fine. They're not going to wake up in pain. It's all going to be a very smooth, controlled process, which I think is absolutely wonderful. One of the reasons I kind of got into that field.
Yeah. Awesome. Well, what advice would you give to current JMU nursing students who are kind of just starting to explore what career path they want to take?
Yeah, it's kind of a hard bridge to jump off of to figure out where your first job is going to be. I was fortunate enough to have the experience in pre-hospital, and I kind of got to see emergency nursing from the outside and realize I thought it was cool, but it wasn't actually for me. Mm-hmm. But the more rotations you can get in different areas, I'm sorry, because you're the clinical coordinator, people are going to be asking you to do all these fun things in different areas. You know, the more you see and the more you realize you like. There are friends who go into the OR. They're like, I love this. Like, this is the life I want. And they went down that route. Friends who got to do their externship in the ER. I love this. And then they went there. I just kind of took a leap of faith and said, it's going to be ER and ICU. I like the ER. I know the ER. I don't know what the ICU is. Let me figure it out. I want to fly. I think this will get me to the flight nurse track faster. It didn't, because I went down another track. But right. I think just kind of seeing what you can see. And if someone gives you the opportunity like I got in nursing school to go to the OR, take it, and then just ask questions. Or if you can go see a procedure, go take it. You can go see what cath lab nursing looks like. It's pretty cool. I think that really helps to broaden up your perspective. And then if you have time, like I did, I mean, I was never a straight A student in undergraduate, but I was doing things like volunteering on the side at the fire department and the rescue squad, and that opened up my whole world of what medicine looks like outside of the hospital, which kind of gave me a better appreciation and respect for what we did inside the hospital. So I think those kind of things are also helpful.
Yeah. And then just kind of the last question, just to kind of wrap it all up. If you could have one message to share with any current students listening right now, what would it be?
Man, that's a tough last question there.
Yeah.
I would say enjoy the ride. It is crazy to think that 5 years has already gone by in terms of when I finished graduating. And if you're like day one of nursing school right now and you're in Professor Carmine's I forgot what the first class was, and you're learning how to change a bed. You're like, oh, this is horrible. When do I get to the real stuff? It's crazy how fast it goes, and just try to learn everything as much as you can because it all comes back. We talked about lifelong learning. We talked about how things kind of just progress, but the stuff that you learn in undergraduate nursing is the same stuff that you learn in graduate nursing. It's just way more in depth. And if your study group or friends are like, why are you getting into the weeds with that? You don't need to know that for the exam. Get into the weeds with it because you'll find out things that you didn't know, and it goes way deeper than we're learning now, and it's only going to serve you later on in life. And when you get into the ICU or the ER or the floor, when you have that deeper clinical knowledge, medicine just makes sense. So learn as much and in depth as you can, and just to kind of enjoy the ride.
Yeah. Awesome. Well, Cameron, thank you so much for joining me. I really enjoyed our conversation. And yeah.
Well, thanks for having me, and go Dukes.
Thank you so much for joining us today on this episode of Practice Makes Purpose. Cameron's story reminds us that nursing is more than a profession. It's a calling that can take you from the bedside to the front lines of emergency care and into the operating room. If you enjoyed this conversation, be sure to follow and subscribe wherever you get your podcasts. And if you're a JMU Nursing alum or know someone who is, reach out. We'd love to hear from you. I've included ways to get in contact with us in the description. Every nurse has a story. Thanks for listening to this one today. See you next time.